Hello, fellow anatomists. It's a great day to talk about the thyroid gland. The thyroid gland is found posterior to the infrahyoid muscles at the level of C5 to T1. If we get rid of the sternohyoid, sternothyroid, and thyrohyoid muscles, we can see it better. So here we have the thyroid sitting in the pretracheal layer of the deep cervical fascia. It has a right and a left lobe, which are connected by the isthmus. And the thyroid gland produces thyroid hormones T3 and T4, which regulate the body's metabolic rate, and it also produces calcitonin, which regulates blood calcium levels. Let's look at the nerves that innervate the thyroid gland. It has sympathetic nerve branches arising from the superior, middle, and inferior cervical sympathetic ganglia. Branches of the vagus nerve provide its parasympathetic innervation, specifically the recurrent laryngeal nerves and the external branches of the superior laryngeal nerves. Now let's look at the blood vessels of the thyroid gland. The superior and inferior thyroid arteries supply the thyroid with blood. The thyroid plexus of veins drains blood from the thyroid into the superior, middle, and inferior thyroid veins. Posterior to the thyroid gland are the four parathyroid glands, two superior and two inferior. These glands control the level of calcium in the body by producing parathyroid hormone, or PTH. Like the thyroid gland, the parathyroid gland is also innervated by branches of the cervical sympathetic ganglia, particularly the middle and inferior cervical ganglia. The inferior thyroid artery supplies blood to the parathyroid glands, as well as the posterior side of the thyroid. The parathyroid veins then drain into the thyroid plexus of veins. Now let's do a speed run of the arteries of the neck, starting with the subclavian artery. So, you've got the subclavian artery, the vertebral artery, the internal thoracic artery, and the thyrocervical trunk. Branches of the thyrocervical trunk are the suprascapular artery, the transverse cervical artery, and the inferior thyroid artery, which gives off an ascending cervical artery. Back to the subclavian artery. Its other branches are the dorsal scapular artery and the costocervical trunk, which gives off the supreme intercostal artery and the deep cervical artery. The common carotid arteries branch into the internal and external carotid arteries. The external carotid artery branches into the lingual artery, the facial artery, the ascending pharyngeal artery, the occipital artery, the posterior auricular artery, and the superior thyroid artery, which gives rise to the superior laryngeal artery. The external carotid artery terminates deep to the parotid gland by dividing into the maxillary and superficial temporal arteries.